Hello and welcome. This is Health and Wellbeing, and I am your host, Lois Apasambo. For the first time, over ₦1 trillion has been allocated to the health sector in the proposed 2023 budget. ₦1.5 trillion was allocated to the health sector out of the total of ₱20.5 trillion for the 2023 fiscal year. And this takes about 8% of the budget. The amount comprises of ₦404.08 billion for capital expenditure and ₦508.82 billion for recurrent expenditure. It also includes ₱2.5 billion for aid and grants and a provision of ₱62 billion for retained independent revenue, which could help the health agencies execute their other activities. Well, today on the program, we're going to be discussing the Nigeria budget as it relates to health. And with me on the program is the Program Manager, Public Finance Management of the Center for Justice, Mr. Sundayson Chidi. You're welcome to the program, sir.
Thank you very much. Good afternoon, audience.
Okay, so talking about the budget, and just like I had said, for the first time, seems like we're getting somewhere after years and years of advocating for more to be given to the health sector. We see an increase in budgets allocated to the health sector. Let's start on the good side. And looking at it from the happy side, at least the step has been taken. How will this impact the health sector?
Well, first of all, I would like to say the government has tried, at least for the first time, even though we know 8% is not enough, but they have tried. The fact that they're able to up their game, to give the sector a little more than they have always given, it's a welcome development and it's encouraging. But we desire that it should be more. But first of all, they just have to be appreciated for that bold step to even give it what they gave this time around.
Okay. Just like you said, they have to be appreciated, and because previous years, I'd even give like a breakdown from, I think, 2017 to like 2021 or so. If we put together what was given to the health sector, it's just a little above what was given this year. So yeah, we could say they had actually done something good about it. But we're here to discuss the budget and how it affects the health sector and what should be done and what should not be done and things that are actually included in the budget, and how these things could be used better. From the first part, I'd like us to discuss, we see recurrent expenditure higher than capital expenditure. But I don't want to be talking because this is not a business. This is not a business program. But I'd like you to, let's start from explain just in layman's terms how people can understand, okay, what is capital expenditure and what is recurrent expenditure. So just so they understand when we begin to delve deeper into this analysis.
Okay, capital expenditure, as regards the budget, it has to do with those expenses that are made on capital projects, on projects that will touch the lives of people. For instance, building a hospital is a capital project, right? Renovating a hospital is a capital project. So any expense that is made to provide facilities are examples of capital expenditure. Now, looking at recurrent expenditure, because in recurrent, you have both the overhead costs and, of course, you have the salaries.
Yes.
Where the staff of that ministry or of the sector or all the agencies that belong to that particular sector, all their salaries, remuneration comes from that particular recurrent expenditure. So in layman's terms, that's just the difference between the capital and the recurrent expenditure.
Apart from building hospitals, what other things fall under the budget line of capital expenditure?
So now, other capital expenditure could be buying vehicles, ambulance for the health facilities, for instance, is another example of capital expenditure. Like I mentioned, the renovation, apart from building, is also a capital expenditure. Mm-hmm. So maintaining those systems, those infrastructure, anything you do there are part of capital expenditure.
Okay, so now looking at it basically, one of the concerns that most people will have will be, why would recurrent expenditure be more than capital expenditure? Because capital expenditure impacts the people more. And so why should it take more running the organization, running the ministry, and then the impact is less?
It's an anomaly. Normally, the capital budget should be more than the recurrent, because that is where, just like you said, that is where the lives of people are impacted. So it is an anomaly, and these are the things that we've been clamoring for, saying that there is no way, it is not normal that the recurrent expenditure should be more than the capital expenditure. As good as recurrent expenditures are, salaries have to be paid, the overhead costs have to, the overhead expenses have to be kept aside, because they need them, for instance, to monitor, to undertake certain responsibilities to ensure that even the things that they put over there in the capital expenditure, that they work according to plan. So, but normally, the capital expenditure should normally be more than the recurrent.
Okay, so now let's talk about, there's been advocacy for universal health coverage. Universal health coverage is basically, in layman's terms, healthcare for everyone. And that's basically what healthcare is actually supposed to be. That's why it's called universal health, at least the basics. Everyone should be able to get the basics. Is this sufficiently and efficiently covered in the 2023 budget?
It is not. In summary, it is not. We still have a long way to go. In 2001, there's this, what they call the Abuja Declaration, where they agreed, the AU, the African Union, countries under the African Union came together and agreed that every year they would devote at least 15% of their budget to the health sector. And this time around, they gave us 8%, which is an improvement from what they have been given.
Yes.
But the fact is that it is still not enough. So we have not been adequately covered. So the health system or the health sector still needs fund. They still need better, much more than they were given. And also, of course, apart from needing it, also monitoring it to ensure that it reaches where it should reach, it impacts the life it should impact. So it's actually not adequate. More is still needed.
Okay, so let's talk about, I'd like us to dwell a little bit more on universal health coverage. How does this work? Is it that free services will be given to people, or people pay out of pocket? Because one of the things that we constantly keep advocating about is there are too many people that are paying out of pockets for health services in Nigeria, and that's why it's really affecting the healthcare system, because quite a number of people cannot afford.
It is not expected. We don't expect that the services should be given completely free, but it can be made affordable. Universal health coverage is not talking about giving completely free health service, but at least that the government should make it a bit more manageable for the people. It should not be such that it will impoverish the people the more. That is, you should be able to access healthcare. Your access to healthcare should not impoverish you, but yet you should have access the basic your healthcare that you need.
Okay. So now, when we talk about this universal health coverage, we now begin to tend towards a national health insurance scheme. And in fact, the act was already signed this year, and we feel like that's the way forward. But we're still get to see implementation. For the health insurance scheme, what is the role of the budget in making sure that, okay, this is actually effectively implemented? Because just like you said, it may not necessarily be for free, but at least it subsidizes health for you. So how does the budget help in this?
You know, the health insurance scheme is such that it's like an advance payment is made on behalf of the people, the workers and others. So such that you don't have to, the person accessing the care does not have to pay out of pocket. The difference between that the health insurance scheme and the out-of-pocket expenses is that the out-of-pocket expense, you have to bring out money whenever, at any time, you just bring out money to pay. And it is more expensive. It is more difficult that way. So the budget actually helps because there are certain portions that will go to this scheme because from the budget. So that is why we are encouraging that government should see to it. That's implementation. The act has been signed quite all right.
Yes.
Now, let us put it to work. Let us make sure that this thing works. So the budget has a very big role to play there so that we don't go about paying out of pocket all the time, because certain services may become very expensive for an ordinary man to afford out of pocket. So the scheme is actually very important, and the budget has a very important role to play in ensuring that that scheme is effective.
So I know that the Center for Social Justice actually did a very in-depth analysis on this, but I'd like you to give us some of the things that you were able to point out, most especially as to things that were included and to say things that were excluded and things you feel that, okay, this should have been here because of this reason and this shouldn't have been here because of that reason.
Okay, the fact is that there is no hard and fast rule. There is no one size fits all approach to ensure that this thing is done. But the government needs to see how best make it as the best way possible to achieve it. In the government, we have strategists. They have advisors also. But what we are saying is that in the first place, that 8% is too small. But whereas in the same budget, there are frivolities. There are things that actually have no business being in that budget that are there. Some things are not clear. So if these monies can actually be brought and channeled into the health sector, at least it will increase what is coming to the health sector, and adequate provision can be made for healthcare. So these frivolities are the ones I will talk about to tell you that they are actually not priorities. For instance, how do you explain that ministries will keep budgeting for cars every year's budget, and especially at this time with the crisis we have, revenue crisis, the country does not have money. We go a borrowing. Do we go a borrowing to spend on frivolities? So it is rather those monies that are collected should be rechanneled and brought back to where it is needed. We know the health of every country is very important. The health cannot be divorced from its wealth. So let us invest in this health sector to show adequately and then monitor the implementation of it properly to ensure that it reaches where it is supposed to reach. So these are the things we're actually clamoring for.
Okay. So I'd like us to talk a bit about things that actually affect us health-wise. One of the major issues in Nigeria, we have child mortality, we have maternal mortality, and annoyingly in Nigeria, the rates of child and maternal mortality are quite high, amongst like the top 5 in the world, and we see that attention may not necessarily be given or not given. What parts of when they put the budget is just out there, and we don't see specifics that actually talk about this. How can this be addressed?
In healthcare, there's what we call the primary healthcare. You talked about the maternal health, and we talked about the mortality rate of infants. Now, these are very basic issues, and these are things that provisions will be made for primary healthcare. Now, primary healthcare has a very big role to play in this area to make sure that there's reduction in the mortality rates of children below 5, and also to ensure that mothers actually they don't die when giving birth, to reduce the mortality rate of women at childbirth, and also to ensure that children below 5, children don't die before they get to certain age. They should live. So these investments in these areas will actually help. And primary health care is actually very important, because there the access is this service is brought closer to the people. The essence of primary health care in the universal health coverage is simply to bring that healthcare service closer to the people that need them. You don't need to go too far to access some of these things, and these are some of the reasons why we have this high mortality rate, because access to these facilities are not there, to these services are not easy. So, and we are saying, invest in this. We often say that primary health care is the foundation to the universal health coverage. That is, in a building, the foundation is very important. So if that building is well laid, if the foundation is strong, then we know that the building is going to be strong, or equally strong. So we are saying that strengthen primary health care, invest in primary health care, which is the foundation of health care, so that it can help us attain easily that universal health coverage, because the secondary healthcare and tertiary healthcare is actually going to build upon what the primary has done.
Okay, so I'd like us to take look in depth into this. I actually have a copy of the budget here, and I'm looking at what has been budgeted for the National Primary Healthcare Development Agency, and in total allocation, both personnel, overhead, and capital cost, everything that has been budgeted for the National Primary Healthcare Development Agency is about 19.9 billion naira. Is this sufficient enough to be able to, one, the healthcare system is not so strong, one, to be able to revive the healthcare system and put it at the pedestal we want it to be?
19.9 billion
Yes.
out of 1 trillion. If you work out the percentage, you see what it constitutes. It is actually not enough. Actually, no amount is enough because we are still very far behind. So a lot more needs to be done. Recently, sometime I think last month, when the NBS, Nigerian Bureau of Statistics, released, there's a data they released on multidimensional poverty.
Yeah, the poverty index
right?
of Nigeria.
So we saw that, and look at poverty among children is high. It's still very high in Nigeria. And some of the indicators are health indicators that are used to determine this. Access, nutrition, and some basic other indicators are there. So I think these are investments that we need to make. If we are talking about nutrition, we are talking about immunization, which means that there has to be vaccines.
Yes.
Let us invest more in them. Do you go to health centers and not find vaccines? Then that means the people that need them cannot have it. The essence of this primary health care is that this thing is brought closer to the people. So how is it brought closer to the people when they don't have access, when they don't have it, when they don't have access to those basic things that they need? So a lot more is still desired, much more than was given.
Okay, well, I'd like us to go on a very short break, and when we come back, we'll continue with looking at other budget lines in what has been budgeted for the Ministry of Health. Do stay with us.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite. This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television Star Times Channel 127, Free TV Channel 507, and UHF Channel 38.
Welcome back. If you're just joining us, this is the Health and Wellbeing on ASO Television. And before we went on the break, we've been discussing the health budget for the fiscal year 2023. And I am here with Mr. Sundayson Chidi, who is the program manager for Center for Social Justice. And before we went on the break, we checked out what had been given out to the NPHCDA for the whole year, and just like you pointed out, more should have been done or more needs to be done. I also like us to look out for the Nigeria Center for Disease Control, and that is basically the agency that is in charge of outbreaks in this country. Yes, and when we talk about outbreaks, it takes us back to Ebola, it takes us back to COVID-19. very scary experience for the entire world. And what we have here budgeted for NCDC is about 3.8 billion naira. And not forgetting that apart from Ebola and apart from COVID, that were novel viruses, we had already had in Nigeria outbreak issues. So we had monkeypox, even though it's beginning to come like it's new. We had Lassa fever, we had cholera. So they already had this on their hands before Ebola came or before coronavirus came. And then about 3.8 billion has been allocated or is budgeted for them. How would this help? Would this really help in being able to tackle outbreaks? And because with COVID, we were told that we should very always be in the alert because
lookout, yeah.
well, yes, more and more we should expect more. And so if about 3.8 billion is budgeted for them, would that do the job?
3.8 billion is actually very meager. Outbreaks are not announced. Nobody expects them. Just like when Ebola came in 2014, right? Nobody knew anything like that was going to come. In 2020 or 2019, when this last one was COVID.
Yes.
Also, it wasn't expected. Now, normally, a country should prepare for things, for emergencies, not for, I'm not saying things like, for emergencies, because emergencies are never expected. Now, I don't know what they have in those agencies, but they need a quite good amount of money to put things in place. These people, they should not wait until the disaster comes before you start running helter-skelter. So plans should be made just ahead so that if things break out, they know what to do. So I think 3 billion is actually very small. If you look at a budget of 20 trillion, right? And 3 billion to manage such outbreaks, I think it is actually too small because Lassa fever has been on. It has not ended. You still find them in some communities and some places also. Why is that so? Because we did not prepare and we're not able to handle them as we should. So actually, adequate preparations need to be made. We are fond of this this rushing to when it happens,
fire brigade approach.
We are fond of fire brigade approach, and that is not what we need. Health should be planned. Health should be systemic. It should be able to respond to the need as they come. So I think 3 billion, as much as the government has upped their game, I think 3 billion for such agency is actually still very small. That is why I'm talking about at least let them make it up to that 15%, their budget declaration, which the country, okay, as God will have it, it happened here in Nigeria. And we signed to it. We agreed to it. If we have agreed, then what stops us? Do we agree for something we know we cannot be able to meet up with? I think it's just calls for reprioritization and reallocation of resources to areas where they are needed. And because the health of a country is synonymous with the health of its people, then the government should ensure that that health sector is well funded to ensure that we have a healthy people for a healthy nation.
Okay, you spoke about prioritization, and I'd like us to continue on that trajectory. How do we prioritize? In what ways? Because, when we started the conversation, we spoke about recurrent expenditure and capital expenditure. And truth is, recurrent expenditure actually has to do with running the organizations. Would it be possible, is there a way that it would be possible that if capital expenditure is given more, if there may be a demoralization on people that are actually supposed to run this industry or they're supposed to run this ministry and may now cause like a little back of what we're going back to now, not having people motivated enough to work?
Okay, a large chunk of the recurrent expenditure goes for salaries. And we know that employment is not an everyday thing. So as people, even when they employ, people still retire. So the workforce in that sector actually remains relatively the same. So then why up it? So their remuneration does not change. Perhaps you are in a lower level this year, the next year you get a promotion, your salary increases a little. But of course, remember that some other persons are retiring.
Yes.
So I think it doesn't necessarily mean that they have to deny the people their salary. It will not demotivate them because their salary is constant. So actually they should check that overhead. What constitutes the overhead costs?
Okay.
These are the major things. Are there things that are necessary? So these are the things we should be looking at. So if we are saying that the capital expenditure should be more, the capital budget should be more, it doesn't necessarily mean, we are not necessarily saying that we should demotivate the people that are doing the work.
You know, the reason why I'm bringing this up is because we're seeing, and I've been so bothered about it, a large exodus of our health workers leaving the country. And one of the major issues across board is remuneration. You know, I even had an interview last week and someone was saying in Nigeria, someone will be paid close to about 100, 200,000. And just 5 hours away on a flight, you'll be paid close to 3 to 5 million naira. And that is actually becoming a problem for the healthcare sector, you know, because health workers are beginning to ask, we should be remunerated more because we do a lot more. And then they're not remunerated enough, more are leaving. So the workload is more heavier on those that are left in the country.
The fact is that even the health sector, workers in the health sector, their equivalent in other ministries, they earn better. Yeah, but of course we know it is still not enough. As much as remuneration is a challenge in the health sector, it is still the same with every other sector. Yes, they should be encouraged. So beyond this, you know, there are certain basic requirements. For instance, you don't tell somebody in that sector, you are telling somebody to attend to, let's say, maybe somebody that has HIV without the necessary equipment. We talked about when this last outbreak came, there were not the PPEs.
Yeah.
So some of these provisions are not made. Sometimes you have to buy them yourself. But these are provisions that should be made so that you don't have to, as a health worker, I shouldn't go to my pockets to bring money to buy things like gloves. They should be there for me to work with. You understand? So when we talk about remuneration, that one is constant. But when we say fund that sector, it includes getting them the basic things they need to do the work they are called to do. So not necessarily going to your salary, going to your pocket to bring out the money to do it. So that's what we're saying. Budget more, give them more, provide for them those basic necessities that they need to carry out the task they were assigned to do. So if these are done, I don't think we will not be having the brain drain we're talking about and our health workers running out every day, because I think it has become a constant thing now.
Okay. So I'd like us to talk about transparency in the budget, even though we're just streamlining it to the health sector. From analysis of the Center for Social Justice, how transparent would you say the budget, most especially for the health sector, is?
As much as, you see, let's first of all give it to the government. The government is improving. Where we were in 1999 when this present democracy came is not where we are today. We have improved. It is getting better, and I think there is still hope for us to get even much more better than we are today. But there are still things that are, for instance, if you look at the line items, there are still things that are unclear, right? So what we are saying is that, in the analysis, one of the things we looked at is clarity of some of the items that are budgeted. Now, it is important that these things are clear. And it's important that they are, for instance, now, you don't tell me 10 health centers will be built. You should be able to tell me the location. They should be traceable. They should be monitorable. So in terms of these, so some area, some are still, they are still lacking in some areas in terms of being specific about some things, being transparent, because sometimes we tend to think that these are intentional acts to hide some things.
Yes.
So we believe they can be more transparent than they have been. As much as they're improving, they can even improve much more. Okay.
So I'd like us to streamline it to the budget. Okay. I know you just give an example of, we'll build 10 primary healthcare centers. In this 2023 budget, are there places you have actually earmarked and said, this is not clear in this 2023 budget, and we need a big clarity on this?
Okay. The proposal, that budget proposal is still out there.
Yes.
It's still being deliberated on, right? Like, even in my organization, I have not critically looked into that particular thing, but there are. But I cannot specifically say at this moment right now. But what I'm saying is that there are still items that are not clear. Okay. There are some areas where a more transparency is needed. We have written, my organization has written, we have made our recommendations on areas where we believe that the government can make improvement, areas where we think clarifications are needed, areas where we think that some reapportioning of resources are needed. So we've made these recommendations, and it has been sent to the House and other stakeholders, so to engage them so that they also can look at it also. Perhaps these are busy people, the legislature. The legislators are busy people, so that it can help them in their deliberations. It can help them in deciding during the appropriation process. So we've done that, and we've sent it to them. So there are many things that came out there, and it is for them. So I wouldn't start mentioning this and that and this and that. But what I'm saying is that anybody that has access to that budget, go to the proposal, go and check it. You'll see for yourself. These things are there.
Okay. Now, talking about accountability and transparency, and just like you said, anybody that has access to it can go check out there. But one thing we found out over time is that you find very few people interested in this.
Yeah, people are not interested. Okay, they seem not to be interested, not as if they are not interested. They seem not to be interested because the budget is a very bulky, and sometimes it can be boring maybe because of my own background, I want to look at it. But not everybody wants to look at it. But there are simplified versions of budget, which is the citizens' budget. It is simplified such that a layman will be able to understand. Maybe that document that is like 600-700 pages or so can be brought down to something very, very small that a layman can understand. Sometimes with pictorial representations. So the only reason why people don't want to go to it, where do you start from? As a layman, you pick a document of 600-700 pages. You will now think of it, where am I going to start from? The moment you open it, you become scared. So I think that is just it. But people are encouraged to actually, that is why, in those times, it was difficult. You don't just have access to these things. But now people are beginning to have access to them. Now that we have access to them, it is not enough for us to complain that the government has not done this or they've not done that. What have you done even as a citizen? Because even the government, they are persons like you and I. So we all have roles to play. Your recommendations can go a long way to solve certain problems. So we still encourage people as much as possible, the civil society and the general public, go take a look at the budget. It can be just a sector. It can be just a ministry you want to look at. Take a look at it and see what is there. We even encourage communities, for instance, like in state budgets, take this budget, know what is coming to you. That way you can monitor its implementation. You will know what is coming and when it will come. You begin to look out for it. That way you can monitor how it is being executed. You know the specification, and so these things are. It's actually encouraging that people should go and look at these budgets.
Okay.
It's actually good.
Okay, because one of the reasons why I asked is over time you realize that government agencies, departments, and ministries are not actually put under the limelight to scrutinize these things, and basically because people don't show interest in it, so whatever happens, the most we do is just complain about it. So it's good that people are encouraged to, just like you said, you don't have to go through the entire budget, but for whatever interests you, you can just pick that, go through it, and then you could always make contributions to it. And one thing that people don't understand, or I don't know whether it is the fact that we don't understand it or that we don't know, but that as citizens, we have what it takes. We have been given the right to be able to make contributions to these budgets, But I don't know why we don't do that anyways. But before we wrap it up on the program, I'd just like you to give a word of advice to our audience out there.
Okay, thank you. What I would like to say is that we should, every one of us need to up our game. Whether you're government, whether you are just a citizen, we all have roles to play. In this budget we're talking about, because the resources that is being spent, you partly contribute to it. Maybe as a worker, you pay tax. Or as a market woman, some of the monies that are collected from you, some of these rates you pay, you have a contribution there. So it is very necessary that you look at it. When governments see that people are beginning to take interest in what they do, they begin to sit up. That is why I said that where we are today is much better than where we were in 1999. So, and I believe that we should increasingly keep getting better, because we are more enlightened. We have access to information that we didn't have before. We now have access to them. So my advice is, people should take interest in the affairs that concern the budget, because it is their business. It is our collective business. It is nobody's birthright. And I don't even like to call it government budget. It is the country's budget. The government, they are holding power on behalf of the people, because we elected them there. So as our representatives, we expect them to listen to us. So what would they listen if people are not telling them what they should hear? So I encourage people to please come out, tell the government what they need to hear, so that they know that you're interested. They know where it pinches you and begin to make adjustments.
Thank you very much, Mr. Chidi, for taking our time to be here with us on the program. We sincerely appreciate your presence.
Thank you for having me.
Thank you very much.
I appreciate you. Thank you.
Well, that's the size of our package today on the program. Do remember that we have information available to us. You have access to the budget. Please go through it and know how it will affect you in one way or the other. Well, that's the size of the package. Keep it a date with us same time next week. I remain your host, Lois Appasambo, and I would say, do stay safe.